Hi friends, welcome to this video on antenatal care. What is antenatal care? Antenatal care include careful history taking and examination and ordering necessary investigations. Examinations include obstetrical and general examination. Why general examination is important in pregnancy? India is endemic for rheumatic heart disease, asthma and epilepsy like diseases. So we have to do general examination. How many visits we have to conduct in pregnant women? Monthly up to 28 weeks and two weekly from 28 to 36 weeks. From 36 weeks onwards, weekly. What is normal pregnancy? 38 to 42 weeks of conception with fetal weight 2.5 kilograms or more with no maternal complications. What routine investigations we order in case of pregnancy? On first visit itself, we have to do hemoglobin, packed cell volume, blood grouping and RH typing, serology, hepatitis B, HIV and VDRL, and urine routine examination and glucose challenge test, thyroid profile, LFT and RFT we have to order. Hemoglobin, if it is less than 10 grams, we consider as anemia. If mother is RH negative, we have to do husband blood grouping. And serology, if it is positive, we have to give counseling. And urine routine, if the pus cells is more than 5, we have to do a culture test. And if albumin are there, we have to consider preeclampsia. If GCT is 130 milligram per deciliter or more, do a glucose tolerance test. Next, we have to record the general data: name, date, address, age, occupation of husband. Age is, if it is more than 30, it is high risk pregnancy. What we refer to gravida is number of times women become pregnant. Para is status of previous pregnancy that has crossed the period of viability, that is 28 weeks. How we calculate EDD? EDD calculation: to the first day of last menstrual period, we have to add 9 months and 7 days. And we have to record the complaints in chronological order. Usually, if labor pains are there, pain is first followed by bleeding, whereas in case of abruption placenta, bleeding is first followed by pain. Then we have to record complications of different trimesters. During the first trimester, if patient had any spotting, it may be due to threatened abortion and which in future will lead to preterm labor. So we have to record every complaint, whether in first trimester patient has any hyperemesis and features of pilates or any anemia or preeclampsia, we have to inquire. Obstetric history include previous pregnancy and mode of delivery, puerperium and baby status. For example, low-lying placenta in previous pregnancy might have led to C-section, and in subsequent pregnancy, that low-lying placenta may form the placenta accreta in the uterus. So we have to inquire about the previous mode of deliveries and pregnancies. Then menstrual history. Usual menstrual history is 28 to 35 is normal. In PCODs and OCPs usage, irregular periods will alter the EDD. So get a dating scan in the first trimester itself. Here the sequence of events in early pregnancy include: in 4 to 5 weeks, small intrauterine fluid collection with rounded edges. In 5.5 weeks, yolk sac. And in 6 weeks, embryo appears adjacent to yolk sac. In 7 to 8 weeks, amnion appears. Next, we have to record build, nutrition and weight. Usually short stature, we may need C-section. Nutrition, one extra meal we advise of 300 calories. Then we have to record pallor, jaundice, lymphadenopathy or edema. We have to press for 5 seconds with the thumb in the medial malleolus and anterior shin. Usually in pregnancy, pedal edema will appear because of IVC compression by the gravid uterus. We have to differentiate physiological edema from pathological edema. Pathological edema causes include anemia, preeclampsia, hypoproteinemia, and cardiac failure and nephrotic syndrome. What we have to order is RFT CBC and we have to auscultate chest. Fast medical and surgical history. Any history of blood transfusions in the past suggestive of hemophilias. Any thyroid scars on the midline. Any history of hypertension, diabetes, and chronic diseases like tuberculosis or hereditary diseases or any twins. Drug history include any steroid therapy patient is on anti-immunoglobulin therapy or any history of drug allergy we have to inquire.